There's a shocking new survey out of Medicare recipients who say they feel more confident that President elect Donald Trump will prioritize their needs. In the survey of more than 500 Medicare recipients, 72% said they were confident that Trump will lower drug costs, out of pocket expenses, and will strengthen the private Medicare advantage. In fact, Alex Bean, a financial literacy instructor for the University of Tennessee at Martin, told Newsweek, quote, whereas some Republican administrations in the past have been seen as a threat to the federal government's social safety net programs, the first Trump administration was viewed by many as populist in its support of funding and maintaining entities like Medicare. The obstacles for this administration will be how some legislators will want to match proposed tax cuts with slashing Medicare spending and how disorderly Medicare Advantage has become. So that shocks me because Donald Trump just appointed this guy, Dr. Oz, to run Medicare and Medicaid. Now, I'm going to get into why that is really not good. Okay, but first, I want to continue with the rest of the survey, right? Apparently, many Medicare recipients expressed confidence in Trump due to his focus on reducing drug prices during his presidency, said Kevin Thompson, a finance expert and founder and CEO of 9i Capital Group. Okay, but did Donald Trump actually lower drug prices? Because apparently, during his first term, Donald Trump was really helping out with drug prices and protecting Medicare. So obviously, he's going to be the guy to help Medicare. Well, here's the thing. Trump did some things that actually didn't really do anything. So these are executive orders. For example, in 2020, he issued something called the Lowering Drug Prices by Putting America First executive order, which didn't do anything. Mainly because the president cannot use executive orders to implement policies that conflict with its existing law. Okay. Now, Trump also tried 4 other executive orders during his term, which again, didn't do anything to try to lower drug prices. The orders include a plan to eliminate drug rebates, which would actually increase seniors' health insurance premiums. So not good. And allowing limited importation of drugs for personal use, which actually, would kind of help. But the problem is you had a very limited amount of drugs that could be imported. Again, limited importation. Okay. None of these actually represented the kind of reforms needed to lower drug prices, which, by the way, would be Congress's job. And as far as Congress goes, both Republicans and corporate Democrats are paid off by the drug industry to not do anything to lower drug costs. Okay. Now, that said, you know who actually did lower the price of drugs? President Joe Biden. The Inflation Reduction Act, specifically, which was opposed by pretty much all Republican members of Congress, okay, passed through party lines, did lower drug costs. In fact, about 1.5 million people with Medicare Part D saved nearly $1 billion in out-of-pocket prescription drug costs just in the first half of 2024 as a result of the Inflation Reduction Act, which capped out-of-pocket costs to $3,500 a year and then would go down to $2,000 in 2025. So that would be the cap that you would have to pay for out-of-pocket for prescription drugs. That's under the IRA. The bill also allowed Medicare to negotiate with drug companies for a limited set of drugs. Now, I wish that had been more. Okay, I've been talking about how I don't think allowing Medicare to negotiate prescription drugs went far enough because there's only a small number of drugs. But it was a start, okay? There's a lot more that needs to be done. But when it comes down to it, the Biden administration actually did more to lower drug costs and strengthen Medicare than the Trump administration, okay? That said, any of this is going to be rolled back, or I should say, Most, if not all of this, will end up being rolled back once Donald Trump and Republicans come back into power. As I mentioned, Trump nominated Dr. Oz to run the Center for Medicare and Medicaid. This is a man who says his number one priority is to privatize Medicare, which is ironic given that 88% of beneficiaries said that shopping for a private Medicare plan was too confusing. Okay, too confusing. They also said that they struggled with understanding what's covered, making sense of the copays and deductibles, and knowing whether their preferred doctors and hospitals were covered. And Dr. Oz is like, you know what? I'm going to make that worse. Okay, I'm gonna do a full privatization. According to the lever, Oz's plan is called Medicare Advantage for All, which is going to help corporations. Such a program could move seniors, according to Andrew Perez, and most Americans into private insurance plans that have been raising premiums and denying roughly 1 in 10 medical claims, according to a recent government report finding that the plans frequently refuse to cover services required by Medicare. So how do you think these companies make money? They make money by denying your medical care. And so if you go to a fully privatized system, what do you think they're going to do? They're going to deny you care. That's it. And they're going to make your money. And by the way, how's it going to make their money? By having you pay a 20% payroll tax. Yeah. That would ultimately transfer money from workers to the Republican Party's private insurance donors that have already been reporting record profits while jacking up your premiums. So, great. Now, that sucks for us, but doesn't suck for Dr. Oz. Oh, no. Financial disclosures show that Oz and his wife own up to $550,000 worth of stock in United Health Group and up to $50,000 in CVS Health, which owns Aetna. Both United Health and Aetna have reported big revenues from Medicare Advantage plans. In all, Oz and his wife have at least $8.5 million in personal investments in the healthcare sector. And in case it's not clear, this would actually destroy traditional Medicare. According to Oz's own description of the plan, it would eliminate traditional Medicare coverage entirely and fully privatize the program. So this guy wants to privatize Medicare, and Donald Trump just put him in charge of Medicare, and yet you have Medicare recipients that are like, Donald Trump, he cares about me. He is going to he's going to prioritize my needs on Medicare by helping Medicare. Oh, no, it turns out that the guy he appointed to run Medicare hates Medicare and is going to destroy Medicare. How did this happen? How did this happen? Look, propaganda. That's how. Republicans are very successful at pushing propaganda. Okay, that's how we've got a incoming president now who is going to put a pro-corporate ghoul in charge of Medicare that he has openly said, I'm going to privatize it. I'm going to gut it and then take it away from everyone. I'm going to take it away from you and then charge you a 20% payroll tax, which is massively regressive, by the way. Payroll taxes are regressive, okay? So low income and middle class, if it still exists, barely, will pay 20%. They'll be paying way more out of their paychecks to pay for this private insurance plan that is going to replace Medicare. And again, propaganda. Propaganda. Democrats can't get their message out at all, okay, to tell the truth. Why? Because they rely on traditional media, legacy media, right? That's it. Not only that, but look, Democrats have been pushing plans that are confusing, okay, full of means testing and things like the ACA, which rely on private corporations and rely on subsidies going to those private corporations instead of actually doing the most simple plan, which is expanding Medicare to everybody. All right, that's it. And by the way, it's not just the Medicare that we would have today. It would be expanded. Read the Bernie Sanders proposal to do Medicare for all. It is incredibly comprehensive, covers way more than Medicare of today actually covers. Okay, and it would do so saving us money, saving the government money, and saving people's lives. That's the superior plan. Okay. Now, that said, did anybody hear anything about Medicare for all? Unless they're saying, there's these establishment think pieces out there saying like, Kamala Harris's support for Medicare for all sunk her campaign along with wokeness. No, you haven't heard a damn thing about it. And not only that, but what about the public option, right? Joe Biden ran on the public option. Have we talked about it at all? No, not a peep. Not a peep. And because Democrats failed to do anything major on healthcare, nobody thinks that Democrats care about healthcare, which means they have ceded this conversation to Donald Trump, who has concepts of a plan. Well, now we see some of these concepts, which is the privatization of Medicare. So apparently Democrats, and I'm not saying that they didn't do anything on healthcare. They actually did, pass more premium support and made prescription drugs cheaper through the Inflation Reduction Act. But you didn't hear about it. Not enough people knew about this stuff. Why? It's because they don't watch mainstream media. Okay? Vast majority of Americans don't watch mainstream media. And so Democrats, unfortunately, didn't get out their message, whereas Republicans, they lie to your face. They lie to your face and then appoint people who are planning to end Medicare, destroy Medicare. That's what this guy's doing. And so that's, reading the survey results of like, I think Donald Trump's going to do a better job on Medicare. You don't know what's coming. But when it happens, you're going to be like, how did we not see this happen? How did not, I trusted Donald Trump. Well, that would be your first mistake. And unfortunately, for a lot of people, probably their last. Once this healthcare gets stripped away from them, that's it. We're done. And unfortunately, there's nothing that we can do right now to stop the damage that's coming. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.